Good afternoon. My name's Nicola Wayne and I work for Nutricia in the strategy team, and I'm also joined this afternoon by Laurie Cowell, who is a regional nurse manager also working for Nutricia. We are delighted to be shortlisted for a PENNA award in the category of measuring, reporting and acting, and we're going to spend the next 10 minutes talking to you about the service evaluation for the launch of our Nutricia Homeward app, which allows video calls to be conducted between home enterally fed patients and Nutricia Homeward nurses. So to give you a little bit of background on who Nutricia and Nutricia Homeward are, we are the leading medical nutrition feed and service provider. We support nearly 30,000 home enterally tube-fed patients across the UK every year and have a dedicated team of over 150 Nutricia Homeward nurses. And the aim of our nursing team is to enable patients to feed safely at home.
So why did Nutricia look at developing the Nutricia Homeward app? Patients are changing. Home enterally fed patients are now more independent, they're less likely to be bedbound and more likely to be living in their own home. Technology use is also changing. In 2018, 90% of adult patients in the UK were internet users. 85% of the UK population now use a smartphone. And 20 billion apps will be downloaded by 2020 in the UK. In 2018, the Nutricia Homeward nurses conducted nearly 171,000 nursing interventions face-to-face with patients, and over a third of the nurses' time was spent driving. So we had to ask ourselves the question, could a proportion of the nurses' visits be conducted virtually if we had the correct technology in place? So what did we do? In 2018, we conducted an audit of all of the nurses' activities, so including their visits that they were completing, the type of visits, the time of their visits, the duration of their visits, and the actual type of their visit. And this also included their driving time. We were then able to conduct a trial using WhatsApp for some of the visits that the nurses were doing to be able to complete them virtually. This gave us some really useful data, so we were able to then look at building the Nutricia Homeward app and really identify what we needed from it. It needed to be a safe and secure method of communication. It needed to be simple and easy to use and have a similar touch and feel to other commonly used apps that are out there. The video call needed to be initiated by the nurse to ensure they are in the appropriate environment for the time of their virtual call. We also needed pop-up reminders and alerts for patients so they knew when to expect their call and a reminder to let them know it was going to happen. The nurse also receives a reminder as well to let them know which patient they are having their call with. We also needed some other options for more information if it was required. So for example, if a patient was in the app and they wanted to know more information about their feeding pump, they could have a look at that as well. So how did we implement the new Nutricia Homeward app? So the people that were involved in the initial trial when we did it via WhatsApp, we got them to then become part of the Train the Trainer programme. So they were then able to support training over 150 nurses across the UK. They were allowed to have practical time so they could try the app with each other and test it from a peer-to-peer basis to make sure that the nurses felt comfortable and confident and competent to use the equipment before they then had a call with a patient. On the back of this, we also gathered feedback from the nurses to be able to create user guides and manuals, so again they would feel confident when using the technology with patients. And not only with our own team, we then had to let other people know it was there and available to use. So we used multiple different mediums to communicate with healthcare professionals and with patients. What the nurses also did with patients is they supported them to download the app and then have a practice with it as well, so they could see just how easy it was to use and just how simple and what a benefit it was going to be to them.
And the outcomes really speak for themselves. You can see on the right hand side here on the graph that prior to the pandemic, we were conducting between 450 and 500 calls per month. As a result of COVID-19, what we've seen is the use of the app has increased phenomenally. So Since launching, we've now conducted over 9,000 app calls between homeward nurses and Nutricia homeward patients, and on average, 167 hours per month of clinical time has been freed up by reducing that amount of driving time that our nurses were conducting. Prior to COVID, what we found is the app was mainly being used for emergency or troubleshooting advice. But since then, what we've actually found is a huge number of different applications and uses for the app. And patients have actually rated the scores really, really highly, with 88% scoring it as 4 or 5 stars out of 5. So it's also the anecdotal feedback that is really, really important. So some of the feedback we've had from patients is that it's a much faster response, it's much more convenient, so they like the fact that they can actually talk to somebody over the phone or by a video message, so it prevents somebody coming into their home. But it's also reassurance from a familiar face. They know who their nurse is, so to be able to have that video call with a familiar face is really reassuring, and it has prevented hospital visits. So there's just a couple of examples here. One is a student in their early 20s who, by using the app in an outpatient situation, it prevented that patient having to come into hospital to attend outpatients, so they're able to continue with their normal day-to-day life. And the second was an example where, by using the app, the correct treatment was identified really, really quickly within just 20 minutes from that initial phone call. And without the app, it would have been potentially the next day before one of our nurses would have been able to travel out to that patient. Definitely, it would have been a few hours. So you can see the difference that it's made to those patients quite quickly. So some top tips and things that we've learned, because it hasn't been plain sailing all the way through. Some patients have very old phones and they just can't download apps. So despite maybe wanting to be able to use this type of technology, they're just not able to. We need to train our nursing team on some of the very basics of downloading apps, checking settings, upgrading software to help to support patients. And the app champions have been a huge success. So being able to offer that peer-to-peer support has been really, really useful for our nursing team. In the first few months of launch, we needed to have some dedicated support just to answer some of the more admin type questions. And my big recommendation for anybody looking at implementing a project such as this is to start the GDPR and DPIA documentation process early. It just takes so much longer than you actually anticipate it would take. And for us, it was definitely to try and keep the app alive, continually encourage use, sharing success stories. You'll always have some early adopters and some slower adopters, but being able to demonstrate how it's made a difference to both our nurses' lives, but also patients' lives, has really encouraged that uptake across the business, but also encouraged nurses to encourage patients to actually use the app as well, to have a video call. So overall, it's been a great success. Hopefully, by sharing some of our what's worked and what our challenges were, it will help to encourage others to adopt this type of technology. Thank you very much.